Hi, I'm Dr. Angie Ramirez, Chief Medical Officer with Foundation Health Partners. Thank you so much for joining us and listening to all of our providers answer questions around the COVID vaccine.
Hi, I'm Jim Button, a pharmacist with Fairbanks Memorial Hospital. This slide is where are we with the COVID vaccine? So in Alaska, we are vaccinating currently in phase 1 with Pfizer and Moderna vaccines. So there's multiple vaccines around the world in production. But we're fortunate that we have available to us through emergency use authorization the Pfizer and Moderna vaccines, which are about 95% effective. These are the two vaccines we have currently approved. It's important to know that no steps were skipped during the clinical trial process for these COVID vaccines. The messenger RNA technique that they use was actually been studied for over 30 years. It was studied during Zika virus, for rabies virus, and also influenza. But there just never has been such a big push to get this vaccine out to the market. In the case of rabies, for instance, we already have effective vaccines. Influenza, that's a moving target every year, but we've always been able to have fairly effective vaccines. But this new virus was the push we needed to get the messenger RNA to the forefront. Again, it's been studied for about 30 years. And we're very fortunate that the two vaccines available to us are about 95% efficacy. So it's better than most vaccines we've had in the past.
Hi, I'm Dr. Michelle Nays, a pediatrician at Tanana Valley Clinic and Fairbanks Memorial Hospital. We're going to talk about how the messenger RNA vaccine process works. So coronavirus has spiky proteins along its surface. Our immune system is able to recognize these spiky proteins as unfamiliar and not a part of us. Now, I want you to think of this virus as having its own instruction manual that tells it how to make itself. So scientists were able to reach in and tear a page out of this instruction manual, and on this page was how to make spiky protein parts, written in a messenger RNA format. So scientists were then able to translate this messenger RNA into a way that our human cells could understand how to make part of the spike protein. They figured out how to wrap this messenger RNA in a special coating to get it inside our cells. Now, our cells read these instructions from the messenger RNA, got rid of the messenger RNA, and started to do what it was told, which is make these spiky protein parts, and then put some of them on your cell's surface. So the cells just did that, and now they kind of look like coronavirus. So our immune system comes along and says, hey, what are these spiky proteins? That's not part of us. We got to get rid of them. So they go to work and they do what's called the immune reaction, working on this process. Then we might feel fever, fatigue, maybe headache, achy joints, because we're under project clear out the spiky proteins and remember what they look like in case they ever come back. Part of our immune system is working to clear out these spiky proteins. Another part's working to remember it, so if they ever come back, we're ready. So our immune system has antibodies and cells that remember these spiky proteins if they ever come in our body. And if you remember, coronavirus has these spiky proteins. So when they come back, we have the upper hand. So shot 1 gets things started, gets our body making these immune soldiers that are ready to fight. Shot 2 changes our immune soldiers into more like immune armies. Should the real virus come, we are on the ready. But the points to keep in mind are that messenger RNA is just that. It's not a virus. No virus enters your body, so you can't get the virus from the immunization. It's not a live virus. And messenger RNA is a bit of fragile piece of instructions. Once our cells use it, they get rid of it. It can't become a permanent part of us. And that messenger RNA's special coding only allows it to go in part of our cells. It can't go into the nucleus in the center where DNA or genetic material is stored. It can't do it. But what we don't know for sure is how long this will last. For a year, for years, forever. That's going to take some time to figure out. But we do know that if we need a booster, then that's what we'll do down the road, just similar to how we do with other vaccines such as tetanus.
Hi, I'm Claire Stoltz. I'm a family medicine provider at Tanana Valley Clinic. One of the questions that we keep assessing is this vaccine safe? Currently, the vaccine that we are giving and that has been approved by the FDA is the mRNA vaccines, both Pfizer and Moderna. For both of these, no steps were skipped in the clinical trials. They were We took what was typically a fairly clunky process and actually streamlined it a bit. It does feel a little bit rushed in some cases, but it's important to note that there hasn't been any data that is missing. With the faster development, we've done steps in tandem instead of delaying it and having it sit through a bureaucratic process that is kind of run in parallel. We feel comfortable providing this vaccine based on the data that we have because most vaccine reactions occur within 4 to 6 weeks after immunization. So by following people out 2 months afterwards before even thinking about the approval process, we have pretty good data in terms of what the long-term side effects might be. To date, we haven't found anything that is of concern, although we should also note that they will be continued to, as we roll out these vaccines, all side effects will be continued to be studied. And that's part of the reason that we're collecting data as people get them. We look for safety signals and we'll be looking for flags that are trends among populations as we roll the vaccine out.
Hi, my name is Ken Starks, Dr. Starks. I'm one of the hospitalists at Fairbanks Memorial Hospital taking care of patients with COVID. I'm here to talk to you about Alaskans and the conditions that put them at risk for COVID-19. As you can see, the underlying conditions are fairly numerous, but most importantly, that we as Alaskans tend to have many of them. And those underlying conditions really are worrisome in that those people with those kind of conditions are at risk for severe COVID, which means they may require intensive care unit treatment, et cetera. As you can see, 67% of Alaskans have one or more of those conditions. And so we need to be sure that we curb this particular viral illness, and the best way to do that is with a vaccine. So the question is, should I get vaccinated? Absolutely. I strongly recommend that you get vaccinated. A vaccination for all of us will prevent disease or prevent us from getting the COVID-19 virus 95% of the time. And in fact, the other 5% of people who get vaccinated but may still get the disease do not get severe disease. The disease is limited and is not terribly does not have the severe consequences that you would have if you didn't get the vaccine. Also, for the good of all, getting a vaccine means that you can't get the virus and therefore you can't spread it to your fellow comrades and family members who might otherwise be sick.
Hi, I'm Dr. Laura Bruner. I am a pediatrician here at Fairbanks Memorial Hospital and at the Tanana Valley Clinic, and we are excited to have this opportunity to talk with the Fairbanks community. We've received a number of questions from the public related to the COVID-19 vaccine, and so we have recruited your Fairbanks providers to answer some of those questions for you today.
Hi, I'm Ben Turman. I'm a physician assistant in family practice at Chief Andrew Isaac Health Center. I'm just here today to answer a few questions about COVID-19 vaccine. So one common question is, can the vaccine give me COVID-19? Bottom line is no. None of the COVID-19 vaccines currently authorized for use, or any of those currently in development in the United States, use the live virus in the vaccine, which could ever cause COVID-19. However, it does typically take a few weeks for the body to build immunity after any vaccination. So that means it is still possible that you could still become infected with the virus that causes COVID-19 just before or just after vaccination and still get sick. The CDC does recommend that you not have any other types of vaccine for 14 days before or after the COVID vaccine. This means when you schedule your appointment for your first vaccine, make sure that it's 14 days from any other vaccine you may have had, such as influenza, Tdap, or shingles.
Hi, my name is Mandana Billings, and I'm a family nurse practitioner at Chief Andrew Isaac, answering some questions about the COVID-19 vaccine today. So one of the questions people are asking is, if I already had COVID-19 and recovered, should I still get the vaccine? The answer is that the CDC does recommend that you still get vaccinated even though you've been infected. We do know that you can have some antibodies that will protect you for a period of time after being ill, but we don't know how long that protection lasts. So whenever you are done quarantining or done isolating, you should get scheduled to get your COVID-19 vaccination done.
Hi, I'm Michael Burton. I'm an emergency physician here at Fairbanks Memorial Hospital. And I'm here to address a question. Is it better to get natural immunity to COVID-19 rather than immunity from a vaccine? No, it's not. You may have some short-term antibody protection after recovering from COVID-19, but we don't know how long this protection lasts. We do know that you can catch COVID-19 again. Also, people who get COVID-19 can have serious illnesses, including a risk of needing to be admitted to the ICU and even death. Also, some have debilitating symptoms that persist for months. Vaccination is the best protection, and it is safe. In the future, COVID-19 booster vaccines may be needed, and this is continuing to be studied.
Dr. Clay Triplehorn, Tanana Valley Clinic and Fairbanks Memorial Hospital. Is it safe for me to receive a COVID-19 vaccine if I'm elderly or if I have a chronic health condition? Yes, it's critical that you get the vaccine should you have a chronic health condition such as diabetes, coronary artery disease, heart failure, heart rhythm problems, or obesity. It would also be important if you're over the age of 65. Patients over age 65 or with these health conditions are at much higher risk for complications from COVID-19 illness. We would encourage you to sign up on the state website to receive your vaccine. State requirements may vary from state to state. Typically, your insurance will not be billed for the vaccine, but you may be billed a small administration fee when you do get the vaccine.
Hello, I am Romel Wren. I am the medical director of Porter Heart and Vascular Center. And I have a question from many patients in reference to COVID-19, and that is it safe for a cardiac patient to take the vaccine? Well, absolutely, it is safe, and it's very important because 20% of individuals infected with the virus will become extremely ill. And this is more likely to happen in patients who have high blood pressure, patients with cardiovascular disease, and patients with heart failure. So I strongly urge all cardiac patients, people with hypertension or those risk factors, to proceed to get the vaccine as soon as it's feasible. Thank you.
One of the questions that we are asked routinely in clinic as I see patients every day is, are there long-term side effects from the COVID-19 vaccine? As we have discussed multiple times, the process was not skipped there were no steps skipped in terms of approving this vaccine. It was just escalated in terms of timeline, and things were done in tandem rather than separately. As I've said before, it cuts out some of the bureaucratic red tape to make this happen in a way that works for our communities. It is very rare that you will get a serious vaccine reaction, but they do happen with all vaccines. We don't have any indication to think that they are going to happen with more frequency with the mRNA vaccines that we're providing. We are continuing to monitor that. One of the reasons that we're comfortable providing the vaccine at this point to so many people is that we have over 8 weeks of data before the initial approval even went in. What we know about developing vaccines and what we've after doing that for many, many years is that when we see adverse effects, they're usually within the first 4 to 6 weeks. And so we are well out of that range, and we will continue to look for those safety signals throughout the population as we give it out, just to make sure that we're not missing something as an outlier, but feel very comfortable about the safety at this point.
Hi, I'm Jenny Lessner. I'm a family medicine physician here in town at Gina Health. One question I'm getting from a lot of my patients, from my friends, and from my family is whether the COVID-19 vaccine has side effects. It can cause some side effects, most of which are pretty mild and go away in the first day or two. People are experiencing muscle aches, a little bit of a headache, even a low-grade fever, and especially a sore arm. The good news is that those are not symptoms of COVID-19 after the vaccine. They're actually a sign that your immune system is working. So if they persist longer than a week or two, call your doctor. Otherwise, feel good that your immune system is kicking in.
Hi, I'm Terry Conklin. I'm an emergency room physician and the current chief of staff here at Fairbanks Memorial Hospital. I'm here to answer your question regarding why do I need 2 shots for the COVID-19 vaccine. The Currently, there are two vaccines that are available. They're more commonly referred to as the Pfizer vaccine and the Moderna vaccine. Both of these require 2 vaccinations. Why? The first vaccine actually introduces the protein to your body's immune system. This takes time for your body to react to and recognize. The second vaccine actually helps strengthen that immune response and get us to the point where we receive what is being reported up to 95% immune response and immunity to. I think these are great results. It takes 2 shots. What we want is a great immune response so that everyone is well protected. We currently have a specific time frame that we need to give these shots in. That's because the researchers that actually made these vaccines did it in a specific time frame, and we want to stick as close to that as we possibly can to help ensure that everyone is protected the best that we can. Thank you.
Hello, I'm Dr. Daniel McCulley. I'm the Medical Director of the Denali Center here in Fairbanks, Alaska, and also a physician at TVC. So a question I'd like to answer today is, why is it important that long-term care staff or those that work with seniors receive the COVID-19 vaccines, even if the seniors are vaccinated? So I think this is a good question, but there are a lot of reasons that it's helpful for people that work with seniors to be vaccinated, even if the seniors themselves have been vaccinated. So just for a little bit of background, we do know that people that are older than 65 have a much higher risk of dying from COVID-19 or having serious illnesses comparing to younger people. And I think it's very important for us to do everything we can to try to protect our older adults. So there's been more than 135,000 deaths in nursing facilities throughout the country. That's less than 1% of the population in America lives in a nursing facility, but about 40% of all the deaths from COVID-19. So a lot of our seniors will be vaccinated, but some will not be able to be vaccinated or will choose not to be vaccinated. So those of us who can be vaccinated to protect them, it's a good idea for us to. Another thing to keep in mind is that no vaccine is 100% effective, and there are some people that are vaccinated who may not receive the full protection from the vaccine for whatever reason. A lot of our older adults seem like they get a good response from the vaccine, but based on how the studies were done and the low numbers of older people who did get COVID-19 in the studies, it's certainly possible that the effectiveness of the vaccine in older people is less than it is in younger and healthier people. So for all those reasons, I think everyone that works with people that are older in a facility or in any kind of healthcare setting, or just family members in general and the community should get the COVID-19 vaccination if they're available.
Hi, I'm Dr. Angie Ramirez, and I am the Chief Medical Officer with Foundation Health Partners. My question is, I am now in the category that can receive vaccine. How do I sign up, and where can I or my family get help scheduling? The best place at all times to receive the latest and most up-to-date information around the COVID-19 vaccine is to go to covidvax.alaska.gov. On that website, you can review not only the current tiers and who is currently eligible for vaccine, but which locations have vaccine appointments available. If you need help, you can call 1-907-646-3322. If you leave a message at that number, somebody will call you back to assist you. In addition, the Fairbanks Senior Center is also helping seniors who need help registering for an appointment. If all the appointments are filled, please go back and check the website several times a day. As new vaccine comes in, more appointments are opening up at all times. Thank you.
Question is, I have allergies. Is the vaccine okay for me? The CDC currently recommends that people who have severe allergies, who have had what we call anaphylaxis or severe allergy to anything, that they be watched for 30 minutes after they get their vaccine. Remember that vaccines in general are well tolerated, and an allergic reaction to a vaccine is relatively uncommon. If you have mild allergies or no allergies, we recommend you be observed for 15 minutes. So bring a book, be ready to sit with some people who have just gotten their vaccine, and we'll keep a good close eye on you so that you don't get into trouble.
Hi, I'm Kerry Woppett. I'm an obstetrician gynecologist at Tanana Valley Clinic and Fairbanks Memorial Hospital. And I'm here to answer some questions about the COVID-19 vaccination in regards to pregnancy, as well as in regards to fertility. Pregnant women were not included in any of the clinical trials for the vaccine, but the FDA, the CDC, as well as the American College of Obstetricians and Gynecologists, and the Society for Maternal Fetal Medicine, which is high-risk obstetrics, recommends that if a pregnant woman is part of a group who is recommended to receive the vaccine, so for instance, healthcare personnel, frontline workers, they should be offered the vaccine and they may choose to be vaccinated. The current COVID-19 vaccines are not live vaccines, and so we offer other vaccinations in pregnancy that are not live and are safe and have no implications for the pregnancy. Ultimately, this should be a discussion with the healthcare provider and the pregnant patient, and an informed decision should be made between the two of them. Now, in regards to fertility, the COVID-19 vaccine is an mRNA vaccination, and tens of thousands of people have received the vaccination, but there's been no indication that there's been implications of infertility for either men or women. 23 women became pregnant after participating in Pfizer's mRNA vaccination clinical trial, and they reported one poor pregnancy outcome in someone in the control or placebo group, meaning they did not receive the actual vaccine. There is a rumor that antibodies against the spike protein will also target a protein in the placenta of pregnant mothers, syncytin 1, but there is no data suggesting that these antibodies will affect syncytin 1, as they are a different protein. Ultimately, this also should be a discussion with the provider between the woman who is anticipating pregnancy, and if she has any questions regarding fertility, should have that discussion one-on-one with her provider. Thank you.
My name's Becky Taylor. I'm a family medicine physician at Interior Community Health Center, and I'm answering a question today that I get from a lot of patients about if you can receive the COVID-19 vaccine while you are breastfeeding. So while there's no safety data about the COVID-19 vaccine in breastfeeding women, or the effects of the vaccine in the breastfed baby or the milk production itself, mRNA vaccines are not live virus vaccines and are not thought to be a risk to the baby. So if a lactating woman is a part of a high-risk group that is being recommended to get the vaccine, like healthcare personnel, they may choose to get vaccinated.
I'm answering the question that after I get the vaccine, do I still need to mask and social distance? So yes, not enough information is currently available to say when or if the CDC will stop recommending wearing a mask or socially distance. And we understand from studies that the vaccine helps protect us from getting severe COVID disease, but we don't yet fully understand is if it will prevent the spreading of the virus to others, even if you don't get sick yourself. So until further information is known, it's still recommended to wear a mask, socially distance, and should you be exposed to someone with COVID-19, to follow the routine quarantine measures.
Hi, my name is Mara Becker. I'm a physician assistant at Chief Andrew Isaac. I was asked a question. It was, if I develop symptoms that may be due to COVID-19 in the time period after vaccination, do I still need to get tested and self-isolate? The answer to that is yes, and the reason for this is that you will not have immunity until about 2 weeks after your second vaccine, meaning it is possible to still get COVID if exposed during that time frame. Also, the vaccine is not 100% effective, so there's a very small chance that you could get COVID even after vaccination. The current recommendations for those receiving the vaccine remains the same as those not yet vaccinated. If you develop COVID symptoms, you should be tested and self-isolate until you receive your results.
Another question we get is, after getting the COVID-19 vaccine, will I test positive for COVID-19? There are lots of tests that you can use to look for COVID-19. On the PCR test, which is currently our gold standard, there is no way for you to test positive for the PCR. The PCR looks for viral skeletons in the nose, and the vaccine only encodes for the M-spike protein, not the actual virus. So there's no way for those to overlap. It should be noted that in the best case scenario, you should be producing antibodies. So if you do an antibody test, which is also available out on the market, that would test positive. But there's no way to get a false positive PCR test from the COVID-19 vaccine.
One question was, will a COVID-19 vaccine alter my DNA? And the answer to that is definitively no. The Pfizer and Moderna vaccines, COVID vaccines, which are approved for emergency use in the US, do not interact with your DNA at all. They are messenger RNA vaccines. What they do is just have a little snippet of the COVID virus, the mRNA. So your body will then, your natural immune system will recognize that and build up antibodies against it. It'll remember it, and then the next time, if you are exposed to the actual virus, it'll be able to mount a healthy immune response. So your DNA is inside of the nucleus, and the RNA in the vaccines do not interact, do not go near that at any time.
One of the questions that we've received is, can children receive the COVID-19 vaccine? At this time, we're in January of 2021 when we're recording this, there are currently no vaccines that are available to children under the age of 16. The Pfizer vaccine is available for age 16 and above, and the Moderna vaccine is available for age 18 and above. Right now, the best way that we can keep children safe is by vaccinating the adults around them. We're hoping that there will be additional vaccines that come available and that we'll have vaccines for children hopefully near the end of 2021.
The question that I've been asked to answer is, I saw on the news that COVID-19 mutation was identified in the United Kingdom and another in South Africa. Will the current COVID-19 vaccine still be effective? The answer is yes. So all viruses mutate a little bit. And remember that the portion of the virus that we are targeting to have our immune system recognize as abnormal and therefore kill is what's called the spiky protein. The spiky protein is also pretty much mandatory for the virus to work. So these minor changes and mutations that occur with this particular virus, unless they affect the spiky protein, are not going to make the vaccine ineffective. And so therefore, we right now don't have a COVID-19 virus that is not susceptible to the vaccine. So get your vaccine. It'll protect you from getting COVID-19.
Thank you to that team who did such great work answering all those questions that we received. We hope you found the information helpful. We know that as things continue to change and develop, there'll be additional questions. So this is a list of resources that are available on the internet for you to research additional questions as if you have them. And again, if you have ongoing questions, please feel free to reach out to FHP Community Feedback at foundationhealth.org.
Thank you for taking your time to join us today. I really want to extend a special thank you to all of our community providers as well as FHP providers who spent their time to put all this information together for you. As a closing reminder, however, even with the vaccine, we are still in a period where we need to be vigilant, and that means masking and physical distancing at all times. With this, we can get to the next new normal together.